Hey guys, welcome to today. And we are talking to Jessica Drummond, and she's the founder and CEO of the Integrative Women's Health Institute. Welcome, Jessica. Tell everyone a little bit about yourself.
Thanks so much for having me. It's my pleasure to be here. And so my career started just about 20 years ago in sports medicine, physical therapy, if you can believe that. But pretty quickly, I transitioned into doing orthopedics for women's health issues. So things like, clients who had shoulder pain related to breast cancer surgery, or women who had back pain related to pregnancy. And, so within the first 3 years of my practice, I began to specialize in women's health. And then I got sick myself around 2003, 2004, after the birth of my first daughter. And that's what led me from very traditional physical therapy practice to integrating with functional nutrition, functional medicine. And I went back to school and got a doctorate in clinical nutrition with a functional medicine standpoint. So I combine all of that, and primarily my practice is around pelvic pain, endometriosis, and fertility, pregnancy, and perimenopause from both a kind of musculoskeletal, neuromuscular skeletal and kind of biomechanical approach, but also biochemical now that I bring nutrition into the practice.
Awesome. Well, let's talk about how fasting can help with endometriosis. So first, I want you to talk about what is endometriosis and how does fasting help that?
So endometriosis is still controversial in terms of what it is, but at the core, it is lesions of tissue that is similar to the tissue that's inside the lining of the uterus, though not exactly the same, that somehow is growing in places where it shouldn't be growing. So, for example, lesions sort of like cancer that might be growing on the bowel or on the outside of the ovaries, or it's even been found on the lungs, in the nose, on the knee, but usually it's in the kind of abdominal pelvic area growing outside of different organs. Bladder is another place it's common. And so, or on the outside of the uterus. And so these lesions, they are not cancer, they're benign, and they usually don't become cancer, although there is an increased risk for cancers in women who have endometriosis, some pelvic cancers and other women's cancers. But it's this growth of these tissues that seems, definitely is related to being made worse and perhaps spreading more if someone has more inflammation. So it's an inflammatory disease. There are some autoimmune type components to it, and it is heritable. There is some genetic component. About 1 in 10 people with uteruses have endometriosis, so it's very common. And we see that also in sort of female fetuses who, for some reason, were not born, and they did studies on that. So it's something that people have all their life. The disease process exists even at birth, but normally it doesn't present until a girl is in like pre-puberty and starts presenting with things like stomach aches or super bad periods that keep her out of school, or pain between periods. It's the number one reason that middle school and high school girls miss school. It's very painful. It can cause infertility. So it's not completely understood in terms of how it occurs and how we can get rid of it. And it's actually difficult to diagnose. It's a surgical diagnosis. It can't be diagnosed with any blood markers or imaging, although imaging does help. And the blood markers do help too, because if you see inflammatory factors, then, again, you're thinking, okay, we're on the track, especially in that symptom picture. But there are still a lot of questions about endometriosis in terms of exactly what it is and what causes it.
Did you know that you can get all 4 of the books that I wrote, Waste Away, Fasting to Freedom, One Meal into Tasting, and Freedom from Food? You can buy all 4 books and get the ebook for free. Go right now to chantelrayway.com, or you can go to Amazon. Also, I just wrote a brand new book called How to Delegate Everything But Sex. If you are stressed out and are tired of doing everything on your own, go check out Delegate Everything But Sex. And there's all kinds of freebies on the site. So I want you to talk a little bit about how the effect of estrogen is on your glucose and insulin levels. And I know that the hormones estrogen and progesterone affect how your cells respond to insulin. And talk a little bit about perimenopause and what happens in the changes in your hormone levels and how those fluctuations can change your blood sugar levels.
Yeah, so estrogen at a healthy level, so a woman's menstrual cycle starts day one, the first day of bleeding, right? And at that point, all of the sex hormones, estrogen, progesterone, testosterone, are at their relatively lowest levels. But pretty quickly, around between days 3 and 5, estrogen especially and testosterone start to increase. So you have your highest levels of estrogen and testosterone about the week before ovulation, which is about the halfway mark of the menstrual cycle. So when estrogen in particular is at its highest levels, women are naturally more insulin sensitive, which is good because we can kind of, it's easier to fast, first of all, because your blood sugar is going to stay more stable. Eating sugar.
So hold on, let me repeat what I just heard you say. You're saying when your estrogen levels are higher, it's going to be easier for you to fast. Is that right?
Mm-hmm, absolutely.
And what's the reason?
It's going to feel easier because it's easier to maintain a healthy blood sugar level. Your body is just naturally more insulin sensitive.
Okay.
And it becomes more difficult. So here's the crazy nature challenge that we get the second half of the cycle. In the second half of the cycle, estrogen is lower, progesterone is higher. Women are more insulin resistant to a degree. So the challenge then is that you're craving sugar, but it's more bothersome. It causes more perturbation to the system because insulin levels are going to swing more wildly if you eat sugar. You're going to have those sugar increases and sugar crashes more pronounced than in the first half of the cycle when it just naturally stays a bit more stable. So when you're craving less sugar is actually when your body can handle it more. Does that make sense?
No, say that one more time.
So when you're craving less sugar in the first half of the cycle, or at least just before ovulation that week, you're more naturally insulin sensitive. So you can tolerate more sugar, but you're not really craving it because your blood sugar is pretty steady. In the second half of the cycle, you know how women are always saying in their PMS time, it's like, oh my gosh, give me the chocolate. Mm-hmm. But you can't, it's better to make sure you really don't eat chocolate at that point because you're going to cause more problems with your blood sugar stability.
So, I've asked different people this question of like what days for a woman is easier. And I've heard different people. And some people say, okay, between days 6 through 10, it's easier for them to fast. And then some people say between days 14 and days 20, those two windows are the easiest for someone to do a longer fast. Do those two numbers that I just said mean anything to you when I say that, and why would that be the case for certain people?
Yeah, so I think the earlier, so 6 to 10, maybe even 13, 14, depending on when someone ovulates, from a blood sugar standpoint will be the easiest. What was the second thing you said?
14 through 20.
So 14 to 20, you're going to be having a surge of progesterone. Now, potentially what could be going on there is more like you're in a time where you're less going to be in your sort of masculine energy. So we're getting out of biochemistry and a little more into how these chemicals can affect the brain and our intuition and things like that. So second half of the cycle, especially right then when you have more of a progesterone surge, this is when we naturally have better intuition and we naturally want to kind of huddle up at home. You want to be kind of, snuggled in your flannels and talking to your girlfriends. This is not when you want to be giving like your biggest work presentation or, going out to meet brand new people. Like you're less relatively extroverted, let's say. And so that can feel like a time where, okay, you can fast now because you're not doing much anyway. You're kind of pulling your energy in. Now, biochemically, your blood sugar is going to be a little more unstable, so it might be technically more challenging to fast then, but you're not right up at the last, if you were like telling me days 24 to 28, that's when all the hormones are at their lowest level. So that's going to be the most challenging. But I can see how earlier in what's called the luteal phase, that second half, if you're just almost kind of doing a self-imposed retreat, a kind of rest and recovery time, that could be valuable because progesterone also helps with things like sleep and calm and lowering anxiety levels, things like that.
So talk about some tips. What are some tips for women who are struggling with pelvic or sexual pain? What are some of the tips that you have for them?
So in that sense, where we really want to start is two places. We want to start with optimizing digestive function because with pelvic pain, it can be exacerbated when someone's struggling with things like constipation or diarrhea or IBS or SIBO, an overgrowth of bacteria in the small intestine, which will give a lot of bloating. So we start kind of mapping the digestive function from the top down. So are we eating in a calm, mindful way? Are we chewing our food thoroughly? Do we have good stomach acid, good digestive enzymes? Are we eating a very anti-inflammatory food plan that's easy to digest? How is our gut motility? How is our positioning on the toilet? How's our bowel function? Just top to bottom, good digestive function. And then the second thing that I think intermittent fasting can really help with is thinking in general about living a low inflammatory lifestyle. So once you've kind of taken out those inflammatory sugars and processed grains and a lot of alcohol, caffeine, things like that, and just adding lots of vegetables, lots of high quality protein, lots of healthy fats, so you've got a stable food plan, then eating in that more intermittent fasting window where you've got periods of 12 hours or even more where you're not eating is an opportunity for the immune system to reset. And as I mentioned earlier, endometriosis and other pelvic pain conditions, vulvodynia is another one, definitely have some autoimmune characteristics, and they're both inflammatory. So if we can quiet the inflammation of the immune system, kind of reset the immune system, which can happen anywhere from those 12-hour fasts to longer fasts, 3 days is another good number in the literature, then once your body is prepared to do that level of fasting because your blood sugar is more stabilized, then it kind of amplifies those anti-inflammatory effects and those immune health effects, which can give you even deeper benefit in terms of pelvic pain conditions.
I don't know about you guys, but I am stressed. And if you're feeling overwhelmed this holiday season, then I get it. With all the family get-togethers, it is just a relentless source of stress. But anyway, there is something that I've got called Stress Guardian, and it's actually made by Bioptimizers, the people who make the magnesium breakthrough, which I love, love, love. But anyway, they are literally made this new product. It has 14 adaptogenic herbs, and it just regulates your stress. I just actually took some right this second, and it's awesome. If you go to stressguardian.com/wasteaway and put in waste away for 10% off your first order, it's stressguardian.com/wasteaway. Go there now.
Let's talk about caffeine for a second. I just recently weaned myself completely off caffeine. I don't drink any at all. And I do feel so much better because I feel like caffeine kind of brings highs and lows. Have you seen any good results from people who've weaned themselves completely off caffeine or reduced it? What's your opinion on that? Because the downside is that caffeine really does help people to extend their window. So like, if someone is wanting to have coffee in the morning, it really does help them have their fast longer. But let's talk about the pros and cons of that.
Well, I think another pro to having, a good quality morning caffeine, something like a clean coffee or just a clean black tea, something like that, or green tea. What you don't want to do is, have really like a coffee milkshake. That's what a lot of people end up eating, right? But if you're having just a clean source of caffeine in the morning, the other benefit is it can help with the bowel training. So daily good quality bowel movements is really helpful. But most of the time, I recommend that my patients with pelvic pain eliminate or reduce caffeine because the benefits outweigh that. And usually once you've got enough magnesium and things like that, you can still have good bowel movements and good exercise. So the other benefits to removing caffeine completely is I see definite sleep benefits. And sleep is such an important thing for recovery and immune resetting. The other benefit of reducing caffeine is exactly what you said, that elimination of those more high and low energy swings, blood sugar impact, insulin impact. So most of the time we eliminate caffeine at least for a month or so while we're really trying to lower inflammation and build stress resilience. 1 to 3 months is ideal. Then as people's stress resilience increases, sometimes they can tolerate a little bit of caffeine. But really, I find less is more, especially for women, because it just does give those energy swings and it affects sleep so much.
So I've seen on your website that you've helped a lot of women kind of lose weight. How does them losing weight really affect their hormones in general? And what kind of other tips besides fasting do you give them to help them to lose the weight?
So the first thing is about streamlining the food plan and more about adding nutrients than eliminating things. People get so caught up in eliminating that they forget like what they need to eat for nourishment. So 8 to 10 servings of vegetables per day and lots of herbs and spices. Herbs and spices are very anti-inflammatory. Oregano, rosemary, ginger, cinnamon, garlic, things like that. For women in perimenopause who are trying to lose weight, one of the things we have to be careful of is kind of over exercising and under recovering. So we think about this in athletes all the time, but if you think about what the average kind of 40, 45-year-old woman is doing, she's got a full-time job, she's commuting, she has children, she has aging parents, going to spin class is going to add a level of intensity to that may not be helpful. So more strength training, high intensity, intermittent training, kind of burst training, but not overdoing that, making sure we have some days of recovery, yin yoga, sleep, nature walking. There's not most women are not prioritizing recovery. If they're getting exercise in, they're getting it a little sporadically and they're getting it too intensely. Mm-hmm. So we have to think about recovery. Good quality sleep, hydration is also key. And then thinking about how to eat. So, timing of food, including thinking about fasting as an option is so important because a lot of times women are so busy that they don't eat during the day and then they're eating a lot of food right before they go to bed. And that's not going to be helpful either. So those are really some of the most important things when you're thinking about perimenopausal belly fat. It's consider your exercise and your nutrition in the context of how busy and stressed you are. Because building stress resilience is probably more important than anything else.
Great. Any other tips for balancing someone's hormones? I'll ask you a question. For me personally, I know for me, the right before I don't get headaches that often, but right before I'm about to start my period and right when I'm about to end my period, I get such a horrible headache, like really, really terrible headache. Anything that you recommend for that, or anything else to balance your hormones?
Yeah, those headaches generally are an estrogen kind of either withdrawal headache or an estrogen dominance headache. So there's
Does progesterone cream help with that?
It could. That's not what I would start with, though. That's sort of like an end stage way of doing it. I would start with liver function optimization. So make sure you're getting at least 3 to 5 servings a day of cruciferous vegetables, or doing a supplement like DIM, I3C, or broccoli extract, something that really supports liver, even milk thistle teas. Hydration is really key. The other thing I found to work well is taking proteolytic enzymes between meals. So proteolytic enzymes with meals just help to digest food, which is fine. But if you take them between meals, they're very anti-inflammatory. And I found that that's very helpful with headaches, especially those kinds of headaches. Something like Wobenzyme, or, a good proteolytic enzyme that we would use kind of post-surgically to lower inflammation. The end of period headache is probably more an increase in estrogen. So again, back to the cruciferous vegetables, green juices, hydration. Some people benefit from things like flax seeds and chia seeds, or even psyllium husk. So like an added scoop of fiber basically can also help with that, because some of the more exogenous estrogens, things like estrogens that come from plastics or come from the environment, need to be processed through the gut bacteria, not just the liver. So it's the endogenous estrogens are processed through the liver, but the more kind of pollutant estrogens are processed through the gut bacteria. So we want to make sure we've got really healthy gut bacteria, and fiber is probably the fastest way to optimize that. Probiotics could also help as well.
Guys, I just want to interrupt for just a second, and I want you to hear Paul Saladino talk about why liver is so important. And if you don't like liver, we have another option for you.
Your ancestors were eating liver. And the reason that this sort of wisdom has been passed down is because liver is very nutritious. It's basically nature's multivitamin. If you look at the nutrients in meat, they're great. You've got zinc, you got B6, you got B12, you got some K2. But if you look at liver, it really complements what's in muscle meat. And there are many unique nutrients found in organs, specifically liver as a powerhouse of these, that are difficult to obtain outside of liver. Like meat and organs are like peanut butter and jelly. They just go together. They're supposed to be eaten together. The easiest way to eat liver is just to do it raw. If you don't want to eat liver raw, you can cook it. But the reason that I like to do it raw is because there are unique nutrients in liver that are probably somewhat degraded when you cook the liver.
This really is like the most nutrient-rich supplements that you can find, and they are amazing. I have tried them. I absolutely love them. So just go to heartandsoil.co, use the coupon code, and save you some money there. And so you're saying basically that one of the most important functions of the liver is to break down and remove excess hormones from your body. And one of the hormones in particular is estrogen, because if you have too much estrogen and your liver's not filtering it, then you're going to have problems.
Correct. And we urinate that out basically. So if you're dehydrated, even if your liver's great, then you're not going to be really excreting it.
Yeah, I heard a good analogy from someone, I don't even remember, but they said that, your liver functions in your body the same way a pool filters functions in a pool, right? And so like a pool cleans all the dead leaves and the dirt and the insects, and your liver detoxifies all the harmful chemicals and toxins, including excess hormones that you need to get rid of.
Yeah. And so those are processed through the liver, and then some of them are also processed by gut bacteria, and then you poop it out. So same thing, if you're struggling with constipation, or your fiber is too low, or you're not getting, you don't have the balance of good bacteria, then that's another challenge that could back up the pool filter, if you will.
Any tips for people who are struggling with constipation for you that you feel like these are good tips that you've seen people really help eliminate?
Hydration is the first one. The second one is having kind of a bowel schedule. So getting up in the morning, having a warm drink of something, whether or not it has caffeine, going to use the bathroom at the same time, using a squatty potty. Sometimes it's actually a biomechanical issue about the pelvic floor not being able to relax. So using some kind of a stool or yoga blocks or whatever you can put in your bathroom. And then another really helpful tool is magnesium, especially magnesium citrate, definitely helps with moving the bowels, and eventually magnesium glycinate, which is better absorbed, but it doesn't affect the bowels as quickly as magnesium citrate.
Awesome. Well, tell listeners where they can find you and follow your work.
So the website is integrativewomenshealthinstitute.com, and we're pretty active on Instagram and Facebook at Integrative Women's Health. So you can find lots of resources in all of those places.
Awesome. Well, thank you so much for being on our show today. And everyone else, stay tuned because we have another episode coming up in just a minute. Bye-bye.